Welcome back at ECCMID TV, brought to you live from our studio here in Pavilion 1 at the ECCMID Congress Center from Lisbon, Portugal. Now, I have a very interesting guest with me on the couch at the moment, because he is Professor Robert Reid, the moderator of the ECCMID Clinical Grand Rounds, of which I've been told that this is one of the most popular program elements that the ECCMID has. So a warm welcome to you, Robert.
Oh, thank you, Judy.
Great to have you
much.
here in the studio, because maybe we have some viewers that would like to hear a little bit more about what are clinical grand rounds, how did they become such a must-see activity. So we'd like to pick your brain about that.
Well, I think they're very popular because they're real-life clinical problems that have occurred.
So they're from real practice.
From real practice, they're real cases, and they were difficult cases to solve. And in this case, we're going to present some fellows, some infectious disease trainees will present cases from all around the world to the professors, and the audience will be able to watch the professors trying to work out what the clinical cases are, the diagnosis, the treatment, and they will do that simply from the information that's provided to them in real time, just as you would do on a normal ward round in a hospital. And I think the audience really appreciates this because often they've seen this kind of problem in their own clinical practice before, and they've had to work out what to do for themselves. And it's nice to see a group of really very, very prominent physicians trying to work out how to make a diagnosis of a typical case and how to treat it in real time. So I think the audience really loves it.
And do the professors, does the panel of experts, do they have the opportunity to ask for more information?
Absolutely. So it's
is it what's being fed, do it with that?
It's an iteration between the professors and the fellow, exactly the same as it would be on a ward round. So you're going around the patients, you're presented the case, and the professors then have to try and extract the information to reach a conclusion about what's going on. So it feels like you're in the ward with the patient in front of you and having to make a real-time diagnosis, usually with very scant information, but often with a real killer diagnostic step that takes you to the diagnosis. And the audience really appreciate it, I think.
So is it often a rare disease that makes the case complex?
It can be a rare disease, or it can be an unusual presentation of a common disease, or it can be a rather complicated process in which maybe the patient has other comorbidities or is on various drugs that make the decisions very difficult, and yet would be things that it's not unreasonable for doctors around the world to have to cope with that kind of thought process, in their everyday practice, because often the patient isn't as straightforward as you'd like them to be, and that's the case with all of these clinical grand round cases.
So the panel of experts, do they have to come up with the diagnosis as a group, or can they make their individual choices?
So what we do is we have 6 professors, and we break them up into pairs of 2. And the reason we do this is so that if one of them can't think of what to say, at least the other one, there's a 50% chance that one of them will say something about the case. And if neither of them can say anything at all, I open it up to the other professors and say, well, what do you think? Does anybody want to add in?
So you have a lot of backup.
So there's plenty of backup. And the idea is we don't want to embarrass the professors. We don't, because they've kindly given their time to take part in it. And so the objective is not to embarrass them, but really to educate the audience. Let the audience see how those professors are thinking about the information that's being given to them, processing and coming up with a diagnosis.
Yeah, well, of course, it's not a real embarrassment if you don't have the diagnosis correct, but I can imagine how it is perceived by those participating. So is it difficult to find your panelists?
Actually, no. I mean, I think 80% of the time when we ask people to come forward, they assent and they do it. It seems to be a sort of a badge of honor to take part, and it is. I have to say, I'm full of admiration for them, because it is a really rather difficult thing to do in front of maybe 1,000 or 1,500 people, plus the online audience. to see them in real time, trying to work through the information that's provided to them.
Yeah.
So
is there any way, are you regulating the cases that are being presented because they are real practice cases?
So what happens is that we invite fellows not just from Europe, but also from the United States, because this is a session that is co-sponsored by the Infectious Disease Society of America.
Yes.
So we ask for cases from the American team. We ask for cases from our various committees within ESCCMID, and they invite fellows to submit cases. We generally have between 30 and 40 cases submitted, and a small committee reads through these cases, and we select a total of 7, including 2 from the United States. But the other 5 are from around the world. So this year, for example, we have 1 from India, and 1 from South America, from Colombia, and 2 from the United States, and then 3 others from Europe.
Yeah, and I can imagine with infectious diseases,
Yeah.
it's you need to have some knowledge about your
Absolutely.
well.
And because we're now, if you like, global in
Yeah.
the cases that we draw from, actually the diseases that we're looking at this year are truly global diseases. So in other
Okay.
words, they are diseases that you need to be aware of.
Yeah.
I mean, even though we have cases that only are seen in India or only seen
Yeah.
in some parts of the southern hemisphere, because of the advent of increased travel and migration, physicians, ID physicians in Europe need to be aware of the possibility of seeing these kinds of cases.
Yeah. So, is there sometimes a case that being presented that doesn't work or doesn't pick up as you wanted it to be?
Well, actually, we work very hard to make sure that doesn't happen.
Yeah.
So the cases, when they finally get presented in front of the audience, have been really very finely tuned so that the audience gets the maximal educational exposure during the case. Sometimes the experts fail to get the diagnosis. That does occur about 20% of the time. Most of the time they get there in the end.
Does that feel like a failure or as a success?
Oh, very good.
For the organizer.
For the organizer, I'm fairly neutral about that. I'm really pleased if we get through the case and eventually the professors get the answer.
Yeah.
What I'm less enthusiastic about them getting the answer straight away, because then we don't draw out that.
Then you want to see the way their mind works.
We don't get the opportunity to see that analytic process in full. So I prefer it when it takes a few minutes before the penny actually drops.
Of course, yeah. And what do you think, why is this so popular? Why do people love coming to sessions in which they have to solve medical problems? We see it with the escape room also. It's also a very popular element in the program.
I mean, ESCCMID is a very mixed scientific meeting. It's a mixture of clinical work, clinical microbiology and science and medicine. I think this is a real opportunity to synthesize all of that knowledge. Because we will be showing people up-to-date diagnostic methods, up-to-date therapeutic options. And so it's a real opportunity to see those applied in real time in a clinical context. So I think the audience, first of all, enjoys seeing professors being challenged with a difficult analysis. And secondly, the opportunity to see how using modern diagnostics and modern therapeutics, you can make the patient better. Because in most cases, the patients do get better, because I think people tend to submit cases where there's been some success, and an interesting problem has been solved.
Yeah. So the audience participates in a way that they get to see how the thinking process is, the analytical process. Is there also a true audience participation? Can they, for example, if the panelists do not manage to figure out the diagnosis?
Okay, so we did try to do that at a couple of ECCMIDs. It doesn't quite work for this presentation to have an interactive component, and the reason is because it's very fast moving. So it's rather difficult to ask 1,500 people their opinion. When we're moving through 7 cases at
I
breakneck
think it's
speed.
important that you mention this. It's 1,500 people.
Yeah. I mean, so it's rather difficult to sort of take all those opinions on board and get through the amount of information we're trying to get through. Ideally, it would be iterative, but in practice, it's hard enough getting all of those opinions from the 6 professors.
Do you also work with, because it's an annual recurring program element, do you work around themes? Do you have certain types of diagnoses that you would like?
We try to give a balance of bacterial infection, fungal infection, protozoal infection, and viral infection.
Yeah.
Often it doesn't quite work out that we include all 4 of those. The most consistent element is quality and difficulty.
Yes.
So, but by and large, over the years, we've had a nice mix of different pathologic processes.
So, and this year, will you be offering the audience of 1,500 people complexity?
We will be offering them quality, complexity, and sheer enjoyment.
Oh, this sounds awesome. Yeah, well, great. Well, we wish you a lot of success and fun with the Clinical Grand Rounds. Please, people can just, you don't have to register, right? You can join and attend if you would like to, and I would definitely, most definitely do so. Thank you so much, Robert, for coming here in our TV studio and explaining a little bit more detail about what the Clinical Grand Rounds entail. We will be tuning out here at ECCMID TV, but we will be back at 3 o'clock on the sharp with Professor Jesus Rodriguez Baño, who is the ESCMID immediate past president and guidelines officer. So we hope to see you back then, and then we can hear together how he has been experiencing this year's ECCMID and hear his future perspectives for the coming days. So hope to see you then, and until 3 o'clock.